Good morning, it's Mark Larson, and here to talk about COVID-19. So things are good. Everybody was out at restaurants last night when I was driving around getting my pickup food for dinner. So that was nice to see people out and about. The weather was really nice. People were social distancing. Restaurants were happy. People seemed happy, and that was really good. So that was nice to see. Churches are working on their plans so they can have services. I don't know which ones will have services this weekend, but I know some churches are planning on having services this weekend, and other churches are just figuring out how to get their safety plans together. So make sure that if your business is going to be able to be open in phase 3, be working on your safety plans, because this kind of took the churches by surprise that they thought they would be in phase 3, and all of a sudden they were told this week that they could open up. So we have had 3 new cases today, none related to Twin City Foods. So it appears that our outbreak in regards to Twin City Foods is winding itself down, but there's still disease in the community. So these are 3 people that live here in the community, and we haven't done the whole case and contact investigation yet. So still a lot of work at public health. All of our current patients that we're following are doing well, and no one from Kittitas County has been hospitalized that are part of any of our outbreaks. So those things are all good. I'm going to take some questions, and then we're going to talk about moving into phase 3.
Isn't it possible that we are closer to herd immunity than is being reported, since the statistics are largely based only on individuals who have been tested for active virus? Will there be more random antibody testing on healthy people in our community to gain a more accurate picture of how many were previously infected without being reported?
Yeah, so at least the data that I've seen is that we're not anywhere near close to herd immunity. There are going to be some people out there that have been ill, have developed antibodies. What we don't know about antibody testing yet is whether or not those antibodies are protective. I personally have tested a couple of patients that were really interested because they had some specific concerns, and even though I'm a little surprised they weren't positive. So antibody testing is not perfect. More antibody testing will come. It's not really helpful as an individual because it doesn't really change your ability to not social distance and those type of things, but it is, as you pointed out, helpful from a public health perspective. I've not seen any plans yet on doing a lot of antibody testing randomly. I'm glad you brought this up because I know there was a study done on prior serum in Kittitas County done by the CDC, and now that you point that out, I have not seen the results of that, so I'll try to get back to you on that next week. I think what we're going to find is that there's more disease out there than we know. In the next 2 weeks, we'll be testing all of the nursing homes and long-term care facilities, as well as their staff. That will give us an evidence of active disease, as you pointed out, but not necessarily immunity. So it costs a lot of money to do antibody testing, and I'm sure that's at least part of the reason that has not been addressed yet. So I think more to come, but that's a great question, and I think it'll take a little while, months, before we have the capability and finances to be able to do that.
I'm concerned for my preschool age children's anxiety levels during this time. They are frightened of people in masks, and they don't understand why the library isn't open. At home, we talk about being proactive and caring for others, building our immune systems, and practicing good hygiene. I feel this is a good time to learn rather than be afraid. Do you recommend any specific resources that might be helpful?
Yeah, another really good question, actually, and one that I haven't thought of for a while, but yeah, some people really are afraid of people with masks. My daughter, when she was little, she was terribly frightened of people in costumes. So I think that's a real thing. The Department of Health has a lot of good resources. The Washington Department of Health has a lot of good resources for families to talk about those things, and those are real concerns, and I would address them through the State Department of Health. So looks like that's the end of our questions for today. I'm just going to talk a little bit about moving into phase 3. So we're currently into phase 2. We have at least 3 weeks to move into phase 3. So I was just on the phone with Amy McGuffin, who's the head of the Chamber of Commerce here, talking about helping people get their phase 3, those businesses that are in phase 3 get their safety plans together. So it's not too early to start looking. Again, look back at what happened with the churches. They were taken by surprise, so things can move forward faster. We wouldn't move fully into phase 3 before 3 weeks, but maybe some things would move sooner. So you should start working on those. For those businesses that are in phase 3 that really want to be open, please don't open, because if we open things too early, then we're prolonged in phase 2. So then that phase 2 will not last 3 weeks. It might last 4 weeks. It might last 5 weeks, because it's all dependent upon spread of disease. So churches are open. I had a long, very healthy discussion with the church leaders this week in regards to safety, and they understand it. And some churches are going to say, we're not ready to open because we don't think it's safe for our community. So people are looking at safety. If you are able to be open in phase 2, make sure that you're following safety guidelines so we can keep moving forward and into phase 3. And if your business is going to be open in phase 3, for example, I've had a lot of discussions with the exercise industry. So gyms are high risk. There's some gym opening that's allowed currently, but we need to make sure that we're following guidelines so we can keep those people safe and keep moving forward. Large group gatherings, not allowed. If we get 50 people together in a house, we're going to have disease, and then we're going to stay in phase 2 for longer. So right now, the amount of people that you can be interacting with outside your bubble are really only 5 people. But let's not get crazy about that. So I meant to mention this yesterday, is that if you are a hairdresser and you cut 10 people's hair in a day, that does not count as your people outside your bubble. That's your work. That's your work that you're doing. So yeah, you're a little higher risk being a worker, just like the person that works at the grocery store is a little higher risk, but that person at the grocery store doesn't count. Your checker at Safeway doesn't have to count every person that they check out with as one of their people in their bubble. Otherwise, they'll never get to interact with anybody else. So 5 people, be logical about it. Try to keep your bubble small, because we really want to move from phase 2 into phase 3, and at a very minimum, that's 3 weeks. So be safe, wear a mask when you can't be further than 6 feet away from other people, and enjoy the weekend. Thanks a lot. Bye.